My name is Samantha. This is my chocolate lab Sadie and my little dog Joey. And today we're going to show you guys how to give your dog an injectable medication. The first thing you need to do is have all of your supplies ready before you begin. You don't want to have your dog in position and then be scrambling around for things that you'll need. So what you're going to need first and foremost is going to be the syringe. This is a prop syringe, so the needle here is plastic. And this is just so that during instruction videos, I don't accidentally poke my dogs. But you'll have a syringe with a needle on it and there'll be a cover. So you want to have that. Make sure the medication is in it. If it's a preloaded syringe, you're all set. If you have the little bottles of medication that you have to fill to the right amount, you want to make sure that that's all done and ready to go before you start. You're going to want rubber gloves. If you have the disposable kind, that would be great. If not, something like a fresh, clean pair of dishwashing gloves would work. You just want to make sure that you're not getting any contaminants into the area, into the injection site. So they need to be clean gloves that have never been worn. If this is something that you're going to be doing frequently, for example, if your dog's been diagnosed with a condition and they're going to need injectable medication from now on, I would certainly recommend picking up a box of the disposable gloves. You can get them at any big box store in the pharmacy area or in any pharmacy. You'll also want rubbing alcohol and either a paper towel or a clean cloth. And what you're going to do with this is you're just going to put a little bit of the alcohol on your cloth and wipe the needle to make sure that everything is sterile. I would recommend doing a practice poke, what I call it, if you've never injected your dog before. So what you would do, you're going to, typically I would straddle my dog while doing this, but I want you guys to be able to see it, so I'm not going to do that. You're going to pinch the skin between your dog's shoulder blades, and you'll notice there's a little valley in here where my finger is. So I would just give a really quick little practice poke just to see how your dog's going to react. And that way, if your dog jumps, if they howl, scream, if they try to run away, you're going to know what to expect. Definitely, if you can have a second person available, that is your best option, especially for a dog that you've never had to inject before. The good news is that if it's something that you're going to have to do frequently for a diagnosed condition, your dog should get used to it after a while, and you will too. Another word of advice is to just be calm and try not to be too anxious about it, because your dog's going to feed off that and it's only going to make the situation worse. So what you're going to do is, I would be wearing my gloves, of course, my needle would be sterilized, and you're going to pinch that skin between the shoulder blades. You'll see the valley in there, and that's where you're going to give the injection. Now, I would put the needle in and then pull it out just a tiny little bit. Don't pull it all the way out, but just a little bit, and look for any bleeding. If there's bleeding, you're going to just let go and start again. That will not happen very often. It's actually very rare, but just in case you do hit a vein, you want to make sure that you don't inject the medication in there. So we're going to put the needle in, you pull it out just a tiny bit. If there's no bleeding, you can insert the needle fully, inject the medication, and then just let go of the skin. You can kind of pet the area over. Make sure you give your dog lots of praise and love for being a good dog during the procedure, and you're all set. I would definitely recommend researching the medication that you're giving, discussing it with your vet, asking about any side effects that you should be looking for, and keep a close watch on your dog for the next few hours. A reaction will likely occur within 30 to 60 minutes of administration of the medication. So just keep an eye on your dog for a few hours. Look for any changes in behavior, any irritation in the injection site, and make sure you seek veterinary care immediately if you notice any of those. Other signs of concerns would be vomiting, seizures, collapse, immediate diarrhea after the procedure within, a short amount of time. So you want to really keep your eyes on that stuff. Lameness, lethargy, those changes in behavior need to be addressed immediately. So take your dog in, see your veterinarian if you notice any of those. Again, speak with your vet, do some research, make sure you know what to look for any side effects that could be brought about because of the medication. And if you notice any, talk to your vet. Maybe you need to change the medicine that your dog is taking if they react badly to it.